Welcome to the Healthusiasm podcast, a panel discussion on trends and innovations in health and self-care. My name is Christophe Jauquet. I'm the author of the Healthusiasm books and a professional keynote speaker on health, business, and technology. Every week, I discuss with a panel of experts the positive changes that are shaping our health and happiness. And this is actually the launch of the third season, although it is a soft launch, because for this discussion, I only have one of your beloved experts in the panel, and that is from Scotland, but living near Brighton, medical expert in digital innovation, Dr. Keith Grimes.
Hey, good morning, everyone. Lovely to be soft launching.
We're soft launching because we're missing Aline, our digital health connector, and Mozowina, our human experience experts. And we are still missing Krupa Sutar, customer experience and research expert indeed. But they will be there for the next episode for sure. But tell me, we had a bit of a hiatus. We didn't have a recording in a while. How was your summer, Keith?
Yeah, my summer was actually quite nice and, at times quite peaceful. I was able to go away with my family. Actually, when I say quite peaceful, I've got a large family, 5 younger brothers, 13 nieces and nephews, and we all went on holiday to a villa in Italy and had delightful chaos for about 10 days. So it was very relaxing and very stressful in the best way and reminded me of the real world outside the work world that I really dive into at other times. So it was really, really good. How about you?
Mine was pretty chill. I took 1 month and a half off. So I never been away that long, but I stayed in Belgium. I didn't go on any travels. Traveled a lot in the last months before the holidays. So that was okay. But it was chill as well. By the way, it's remarkable that you mentioned Italy without mentioning the food or enjoying the drinks over there.
Well, of course, the food was fantastic. The drink was great. The overarching memory I have of it in terms of that are 2 things. Number one, the Bialetti coffee machine every day, starting that way. Oh, fantastic. Italian coffee is to die for. And just the blue skies, the sound of the crickets and a big swimming pool with my nieces and nephews attacking me as I tried to do laps. It was wonderful.
Great. But back to work then. In this week's episode, what we will talk about is a topic which is, I think, pretty interesting. We will talk about something, nothing, or everything. And more particularly, we will talk about, are we focused too much on care and not on cure? Are we focused too much on cure and not enough on care? And why do I bring this statement forward? Actually, Keith, it was you who suggested this topic. But I did some research and I did some thinking, and actually, what you said, aren't we focused too much on cure and not enough on care, makes perhaps sense. Let's discuss this in this debate. Because in ancient medieval times, we did not have a lot of tools or solutions to cure. And therefore, we were a lot more focused on care. While if we look at from the Renaissance onwards to modern medicine today, we had a huge scientific revolution, and it's still going on, which actually, shifted the focus towards more curing. Major breakthroughs in microbiology, pharmacology, surgery, even AI now will continue to bring this focus on cure. But that marks the question, aren't we focused too much on cure and not enough on care? And shouldn't we be at a tipping point, or are we maybe at a tipping point where we should be focusing more on care today? Your thoughts, Keith. Is this something, nothing, or everything? Should we focus more on the care and healthcare than perhaps on the cure?
Yeah, I mean, it's such an important point to make, yet so easily forgotten until such time as you find yourself ill or unwell. And speaking as a doctor, and I suppose other healthcare professionals who are a lot of the time on one side of the equation, everything we do is about grounding us principally in the science and practice of medicine, which, as you said, has been revolutionized over the last few hundred years. The scientific method, greater and greater advances, giving us more and more powerful tools, not only to understand humans and illness, but how to address that as well. And of course, this is crucially important. We all want to be able to do that. And because of the technological changes or the science changes, we kind of have more power over that side as well. And so it's quite seductive but also very understandable that we will spend a lot of time on that. Now, it's not to say that while I was being taught as a doctor, even practicing as a doctor, that we forget care. Of course, that's put in there too. But in some ways, the provision of care is a much more intractable problem. We've developed some extra tools on this, but we're still at the heart of it, humans. And it's easier sometimes to focus on
I was about to
the
say
problem. Yeah, it's much easier. I've got a tool to fix this. I'll do that. And then if you have some successes in that and the inevitable kind of successes and failures in the care side, I felt over my career, and even now, that I still very focus on that area. And that matches with how the entire world is lived. You know, we like the idea that we can see problems, find them, fix them, charge for them, you know, find new ways to do this. It's a kind of engine that drives us that way. But at the same time, people, doctors, nurses, people on one side of the equation, or the people that we're serving, or even if we're those ourselves, will frequently start to feel that gap, whether it's a 10-minute appointment where a person can't, gets the information they need, or some of it, but none of the care, don't feel listened to. You're left feeling unserved. And what do you then do? This is a difficult problem to solve. And again, it then becomes convenient to forget about it or park it, but it has to change.
And so it has to change. So it is something, or maybe even everything, according to you, right? Everything.
Absolute it's everything in the sense that it has to be part of everything that we do. You can't just focus on just one thing, but we cannot forget it.
But I mean, three things come to mind here. One is, you mentioned science and the fact that it's exploding, and you're basically trained in science, right? It's enormous. It's hard to keep up with, even when you are practicing. But how much time of the education for healthcare providers is focused on the caring part, and how much is focused on the health science part? If you had to put a percentage on it, how much would you put onto it?
I'd say about, formally speaking, it's probably 90-10, 90% science, 10% other ones. So it's not, it's very heavily weighted. And now, remember, I went to medical school years ago. And so there have been some changes, but then I do spend some time teaching medical students now, principally in health technology and the like. But even then, they'll talk about what they're doing in terms of communication skills, but it still feels like a little addition. So in terms of formal teaching, it still represents what feels a small part. And then the rest of it came from the clinical experience, the time on the ward. And again, a lot of that, I remember being very much about cramming in practice, process, knowledge. And then within that, you would have moments that kind of really felt as though they arose naturally. Or you'd have some good teaching, which would bring it back into the room and it would come back. I got more of that, more of the care side, more of, listening, hearing people's stories, understanding where they're coming from when I did my general practice training. But it still feels like the poor cousin of the other work.
Yeah. And so the question then begs, do physicians, the people that want to become a physician, if you talk to them, I have the feeling that most of them first say, I do it to help patients. But in helping patients, they're more focused on the health science because they are educated that way, right? Is that a correct assumption?
Yeah, but also how the healthcare system, the sort of formal healthcare system, has evolved, really requires you to do that. And that speaks to the rising levels of burnout as well, because we do care. I do care. I do want to care for people. I started to burn out when the demands on me to deliver the sort of health aspect of it, making sure I cover all the chronic diseases, ask all the right questions, code everything, make sure I can get the next person, left little time to deal with the rest. And you can carry that for a little bit, but it builds up. And I broke when I looked at my future of work as a doctor in that role and thought, is this it? Like, is this genuinely all I can hope for? Is like processing people like units on a production line and being kind of flogged to get through them as quickly as possible, knowing with every single one that I could do much more, but not being able to. And that's difficult.
Yeah. And I want to maybe take two, 3 steps back, because we talked about care and cure. We talked about health science, and we consider health science as being the curing part, while physicians definitely consider it as being the caring part as well, because you care by helping or providing them with the right science and the right solutions, right? So that's a part of caring. So maybe we should take 2 steps back and define maybe what do we mean with caring that isn't maybe enough present today? What is the type of caring that you think physicians or healthcare providers in general should be focused on a little bit more than?
When I think about when I have felt cared for by anyone,
That's a good one.
by
By
anyone.
anyone.
That's
Yeah,
another one.
sure.
Yeah. It starts with their attention and their time. I felt most cared for when a person is attending to me, what I'm saying, and hearing about the things that I'm suffering from, be they physical, medical, or emotionally, or anything like that. So it's a function of attention and time, and that has been in really small, small supply increasingly going forward.
It's
And
under
it's a shame.
pressure.
Yeah. But then I'd have it in my work is like sometimes you'd end up with a problem in front of you, or a situation where literally none of the tools that I have are going to work. Like I've reduced it to the sort of tasks, and none of them are going to work for whatever reason. This happens more often than not. And there's a sort of frustration moment. And at that point, what would happen is that you kind of get this emotional breakthrough, like an admission that I can't help with this. I can't, this won't work. This won't do. We can't do this. This resource isn't available. And that sort of shared frustration where I started to feel as frustrated as the patient, and there was a breakthrough in that, which led to an honest conversation, changed everything. And going forward, those relationships improve. Now, I don't want to have to be in a situation where I have to get to crisis to get to that point. So start reflecting more about how you fit that back in. Now, what's interesting is that I see a lot of the work around about care in general being turned into, well, maybe actually if we turn care into a science and approach it that way, then we'll accept it. We'll sort of decompose what it is into something mechanistic, and then we can apply it. And then it's the same as the other stuff. But I think that's missing the point.
And is that then due to the fact that certain types of people with certain types of interests want to become a physician?
Yeah, I think that the way that we select physicians, if we're going to talk about physicians as part of this, is very much dedicated towards what was needed for a physician, maybe even historically. You have to be able to remember a bunch of things.
Intellectual capacity.
Yeah, bring them out very, very quickly. Now that is, I sometimes, if you like the movie Dune or the books Dune, I sometimes think that we're recruiting medical mentats, the mentats being this sort of group in Dune in a world without computers that could perform computer-like functions, store lots of information and bring it forward. So we didn't have those computers. We had to store a lot of information. Let's find people who can do that. And let's select for people that can do that. Now, I think that automatically does two things. Number one, it subselects for a certain part of the population. But number two, even within that group, they will focus their efforts on developing that capability, potentially to the detriment of a more holistic human approach to. Not saying that doctors are without this, but you tend to be selected on that. And then that continues. We're maybe not getting the broad range of people coming in, and then we're maybe not allowing them to sustain that as they go forward.
Yeah. And maybe we can say the opposite from nurses or any paramedic type of supporting staff. They are maybe more focused on care, or they are maybe, I wouldn't say selected, but their type of profile might be more fitting to care. And then the physician relies more on them for that because they are the science part and the other ones are more the caring part, or is that too narrow of thinking,
or too reductive? Maybe. I mean, I think there's some truth in what you're saying, though, in terms of the roles that people play in there. There's that sense that the nurses provide the more caring aspect, and the healthcare, the doctors, or maybe even the paramedics in this situation are focusing on the sort of more science, technical, procedural aspects. I mean, it's not 100% either way, but it definitely does feel that way from my experience of either working with those different colleagues, but also the relatively limited amount I know about how they're trained. But when I looked at how the nurses that I worked with were trained, they spent a lot more time from the get-go, from the very start, with patients and their families and dealing with the care aspects. And initially, when I was working, they had more time, less processes to operate, allow them to do this. Yeah. But even that's going. For all sorts of reasons. So I think wherever you are in it, there's that inevitable sort of drift towards, the the science, the procedure, and away from people. We always talk about going back to people, but it still drifts that way.
Yeah, and I think administration is going up, right? Because there's financial pressure on the system anyway, which makes it even harder for them to focus on the caring part. Yesterday, I was at a conference. I was speaking at a conference, and there was a professor speaking about the near future. I think he was talking about 2030, and he did even some calculations for 2040. And he said that with the population growing older, we would need about 1/4 of the population, the entire population, to be working in healthcare to be able to manage the demand of the population that is growing older, the healthcare demand, that is. One in four.
Isn't that crazy? And I heard something similar, and I couldn't find the source for it, but I remember a few years back when in the UK we were looking at that same kind of statistic, the growth in demand and the lack of supply. Someone told me that at that point, I think it was like 2017 or something, that if we wanted to catch up using our current approach, every single person leaving school from now onwards would have to work in health and care. And that's and
every single person
to catch up with what we would need. Now, that's not saying that every person would have to work. Okay, just to catch up in terms of the training. Now, I have worked my butt off trying to find out the truth behind that. And even if it isn't 100% true, it does begin to illustrate something about if we want to provide healthcare as we do it right now, it's an insolvable problem approaching it the same way. If we just want to train more people to do it the way we're doing it now, cannot be done. It can't be done. So what do? Like, do we try and train more non-people to do it? Do we try and help people to care for themselves? Or do we just accept that within all of this, there's all these things that we technically can do, but we leave behind something, which is what we were starting with, that sort of element of care that needs to be woven back in. There's this kind of impossible goal, potentially.
Yeah.
Because we think of healthcare in one way.
But having more people working in healthcare, because I think right now it's I can't remember actually, it was 1 in 5 or 1 in 6 that is working in healthcare already, I think in Belgium and the Netherlands.
Yeah,
going
huge.
to 1 in 4, it's a huge increase, which also means the budget would increase, not only because of the number of people that need the curing part, but also the people that need to be paid working in healthcare. So that again puts pressure on the system, will add a lot more administration, will make it more difficult, and so forth and so forth. And then I think one of the elements that is also, I don't know, nobody talks about it that much, but if you just look at the potential of AI on the science side, you can safely expect, I believe, at least, that the number of studies, or the number of solutions, or the number of medical treatments that will come out, which is supported by AI, which make the whole process faster in finding the right compounds to put them into the whole, phase 1, 2, 3, 4, 5, not far, 1, 2, 3, 4, and get actually treatment to the market, will even radically make the availability of scientific solutions or even scientific information explode, which make it even more difficult for physicians to handle all of that, even, right? So
so we have to build solutions to help us handle the new solutions,
right?
And it's
so what would that be? Let's focus on the solutions. Let's focus on the solution. What do we need to bring, maybe to be at that tipping point, to bring in a little bit more of care into the health care?
Well, the first thing I think we would do is we should accept that health and care, is not the sole responsibility of the healthcare system. That's the first thing.
I agree.
Because if someone says, to provide the care for everyone in the world, it's like a quarter of the world's population would have to work in healthcare. I would rather that 100% of people in the world worked on caring for people, but delivered care within the area that they're working. So we see some of this already with the rise of the kind of chief health officer in organizations, whatever that organization is, that considers the health and wellness of the people that work in that organization and the impact of that organization of the wider health and wellness, global impact, climate impact, and so on. I think seeing that happen is a sensible way forward. That requires those working in healthcare to relinquish some control over that, or recognize that the wider world has a part to play in those two things. I think that is definitely one way forward. And
I doubt it. I'm not quite sure. I'm thinking out
Mhm.
loud. I work a lot with businesses. I work a
Right.
lot with the corporate well-being solutions and the
Mhm.
physicians even at work. And one of the major discussions that you always see in businesses or in working environments is, do we need to help people or our employees in becoming healthier, or should we just provide an environment which is not unhealthy? And I
Mm.
think that I always see this balance happening. And I see 98% of the companies more focusing on, we need to just make sure that, the environment is ergonomic, that there's a
Mhm.
healthy air and what have you all, just to make sure that people don't get ill. But they don't consider it today, at least yet, their responsibility to take care of the health and maybe help them in, you know, becoming healthier again, whatsoever. It's very rare. It's only when people get sick and they need to have them back on the working floor or in the team that they might do something. But for 99% of the workforce, they don't do anything when
Yeah,
it comes
well,
to healthcare or taking care of their health.
no, totally fair point. You're right to push back on that. But maybe what I'll say is this, is that I'm sure you have also seen examples where someone in the leadership in an organization becomes ill or
Yeah.
has an experience with illness.
Hmm.
Often, the biggest example I often find is about mental health and
Yeah.
mental
Or
illness.
burnout or,
They'll have a
yeah.
brush with that, and then at that
Hmm.
point they come back in, they're rehabilitated back in, and they say, right, at this point I've had a brush with this. I am not going to work in a place that like makes people ill.
Yeah.
And that leans towards that ethical principle of non-maleficence, not doing bad. We're not going to make our place a bad place to work. But within that, people say, well, yes, but that's just one like ethical principle. What about doing good? What about autonomies, like helping people self-actualize? What about justice, making sure that it's available to everyone? We have these principles. You're right that the business environment, the work environment could over-index on not doing harm. I mean, we've got laws in place. You must not do this, you must not do that.
Increasing the
Occasionally,
amount of laws, even it's
yeah,
growing
yeah,
everywhere, right? So
yeah. And you see in healthcare, it's like a focus on the immediate and the urgent versus the preventative as well.
mhm.
That's in part not doing bad later on, so we can forget about it. But it needs to be couched in, but doing good. Humans aren't a problem to be solved. We're here to live, and if we focus just on stopping the problem that stops them living, that's not complete. That's a big kind of human level issue, but it has to inform the solutions that we put in place. And given what you've just said, the sort of realities of this, if we're working in this space or if we have any influence in this space, we have to take the fight to that problem using that language, like how can doing good improve the bottom line? How can making
I
serving a
agree.
wide group of people do help the bottom line? That's one way forward.
In my talks and my focus in my keynotes is not only on the employees. I think businesses maybe even more have a responsibility to play for when it comes to their clients. What can they do to actually bring products, services, experiences on them onto the market that actually make their customers healthier and happier? It was the
Mm,
subject of my first book. It's even extended in my second book as
sure.
well. And I think there's a good opportunity there for businesses because, as we said, the caring is not always present within the healthcare system, or maybe is lacking a little bit. It could be improved. And so I think there's a lot of caring maybe that could be taken up by businesses in some form or some sort. Which then brings us back to, because you said 100% of the people should be, caring, and you went straight to the workplace. I think what we see more and more is that people start taking care of themselves
Mm,
or for their community, or for the people in their communities, or and some social work and all of that. And businesses have a role to play in that. How can they support that self-care part? How can they make sure that within the community there's something happening that they play a role in, which is related to the care and the care of being healthy and happy, of course.
hmm
So what's your take? Because I think self-care, I think in this whole debate, care versus Q, I think self-care will become super, super, super important. I think it will
hmm
be I wouldn't say the only valuable solution, but it will play a big role in that, and finding, more care.
Yeah, no, absolutely. This is, again, if you reduce it, it's enabling everyone to be part of the healthcare workforce by caring for themselves
Caring
or
for each
others or their
other.
family and everything. And so, you can look at any work that's being done. If we take it back to the area that I'm very interested in, the technology side of things, this is
Exactly.
about providing tools for people to upskill either themselves. And you see products like, symptom checkers, triage tools, patient information being provided directly through online resources, online communities, and so on. These are all great ways to kind of raise the capability to deliver care in a kind of healthcare form, but care in the community. The other thing that I've seen, which works very well and great successes, is when we use community health workers, trusted people within a community that are able to influence a large number of people, not necessarily in healthcare themselves, but who take that role to deliver, the ability for people to care for themselves more, be that sexual and reproductive health, be that sort of general chronic disease management. And when I was working at one of my former companies and during COVID, the greatest success we had in uptake on vaccines was not us telling people to take the vaccines or, adding tools. It was empowering trusted people in the community, educating them, and then them acting as the vehicle for the knowledge and action there. That was the most successful aspect. And so there is this identifying those people and empowering them to help themselves, but also others, is, I think, a very effective way of scaling the approach you just described.
Yeah. And I think I think people are looking for those kind of solutions because they can't get into the healthcare system anymore, right? At least difficultly, because you were mentioning attention and time. It takes a lot of time to meet a physician or to see a physician if you have a specific problem. Which brings us to your solution related to tech as well. I know you're a tech optimist, I think that's the right word.
It's a good way of describing it.
And then I think that the one thing I have in mind, and the question I want to ask here, is obviously AI can play a role in that. And I think it's even super important because I believe that AI will also drive people into taking care of themselves, but it will drive people into the healthcare system even more than today. We saw Google, where Google provided some information and people were worried and wanted to talk to a physician about it, about the diagnosis that they found themselves on Google. I think with AI, we'll see that even more. It will be Google on steroids, if you will. And more people will go into the healthcare system. But then again, it's very hard to meet a physician. So the question is, how can AI help there? First part of the question. Second question is, what do you think of having digital humans as a first entry point into the healthcare system, so that your first question is already answered? Maybe some worries you have, some information you found, some feedback you got from an AI tool. And then you go into the healthcare system and your first contact is not a real human being, but a digital human. Two-part question. How do you think about AI and how do you think about digital humans as the extended version, the future version maybe of an AI solution that could provide some first aid care, if you will, the first-hand care?
Yeah. Well, so working in this space, there is no shortage of people that are trying to build solutions that will do some or all of what a healthcare professional will currently do. I've already mentioned them, be that checking symptoms and giving information about what the potential cause is, what potential self-care might be, what the triage outcome is, all that kind of thing. That's already being built and put out there. But you're right, they're all being put out there with a lot of caveats. And the caveats will be, but this is, but you should speak to a healthcare professional if you want to make any changes or not. So how do you cross that gap between AI saying this is what it could be, but go and speak to a doctor, versus this is what it is, this is what you should do?
Yeah.
No, speak to a doctor. Now, the barrier there is a very, very good one and a correct one. It's about regulation. It's about clinical safety. It's about liability. And these are all very, very hot topics within the world of AI right now, because for AI to replace or assist components of what's done in healthcare right now, it has to meet these standards. Now, the question is whether these standards are being set too high. Now, don't get me wrong. This is not about getting things that aren't safe out into the community. But this is more about there's an expectation with these technologies to be perfect. I mean, to be measured in terms of performance way over and above what we would otherwise potentially expect from humans in this regard. And I'm not talking about the best human providing care. I mean, the reality of it, a great doctor being available to spend all their time whenever you want them, magic, but you don't get a great doctor all the time. You don't get immediate access. You don't get as much time as you want. So the performance of the humans that we expect is actually way lower. And we just accept that right now. Yet we still accept the technological solutions to approach perfection.
Yeah, I agree.
And there is an argument that actually, should we be looking to accept technological solutions that are substantially better than what the average performance might be? But that does require one more thing, which is resolving liability. As in, if these technologies make a mistake, who carries the can? And right now, we've got very well worked structures around how to handle that on a human side. But at the moment, what I see from most manufacturers are, well, we ask doctors to check it, and if something goes wrong, well, you know who to sue, kind of thing. That, and all that does, once again, is just load up the human side of the equation. So to get to the point that you're describing, officially, those things need to be solved. Unofficially, people do it anyway. And that's the thing. Yeah. And so one other approach to this is recognizing that will happen, but empowering people when they're doing this to do so as safely as possible. Now, that's a tricky thing. And around the world, there'll be places where healthcare is much less accessible, and you might set the level a little differently. But again, this is dealing with the reality of the world that we're in. And I'm more interested in helping as many people in that space than focusing on trying to achieve an unachievable goal.
Yeah. And it's like a couple of years ago, I think 10 years ago, what I always said is that there is more health data gathered, collected outside of the healthcare system than inside the healthcare system. Mm-hmm. Obviously, the data that is gathered is not labeled. The quality is not, it's not always sure whether the quality is good enough. But there's more data. And at a certain point, that data will become, labeled, that data will become more interesting, and there will be more data outside of the healthcare system than inside the healthcare system. At that point, I think the healthcare system will open up. That is one of the statements I made about 10 years ago. And I think we're almost at that point. With AI, I have a similar kind of thought in a sense that we will see people, as you said rightfully, we will see people use a lot more AI tools than the healthcare system might be using. And this will drive demand for healthcare solutions because they will see that there is maybe something going on with them, rightfully or wrongfully. I don't know. They might not know whether it's a real problem or not, but they will look for solutions. And one of the statements I always make today is that basically I believe that the healthcare system should adopt AI quicker than the general population might be adopting AI, because otherwise, I mean, we said that one of the issues today with the focus that we have a lot on cure and health science and a lot less on care is because of the workload, because of the fact that we don't have enough people working in healthcare, because the demand is too high, because of the burnout and all the administration. But if we don't adopt AI faster in healthcare than it is adopted outside of healthcare, I think that issue will explode even more.
Yeah, well, I mean, I'll actually kind of push back on this a little bit as well. And actually, I think healthcare will never outpace the adoption of technology outside it. It just can't happen. There's lots of really very good reasons for that. But I think that's maybe a fact. So again, if we just build on that and say, well, if that's always going to be the case, it could get faster, but it'll never be as fast as what happens outside.
I agree.
And, what can we then do instead of trying to keep up in this like impossible race? Maybe if we proceed at a slightly slower pace on the adoption to our comfort, but dedicate some of our time to empowering and making safe the non-healthcare use of these technologies for the provision of health and care. I think that makes a little bit more sense to me, which is why I love when I see examples of patients and the public taking matters into their own hands. I spoke to you before about an article I saw about a Netflix think it's a Netflix engineer in San Francisco, and she has health problems and was having a lot of insurance claims rejected. And she started to use AI to help challenge those and got a very, very high success rate in challenging these rejected claims. So I'm like, that's great. It's gone powers in their hand. They're not relying on the healthcare system. What's lovely is that person is then made that more available on a site called Fight Health Insurance to other people to do the same. And this is about recognizing that if we don't meet their expectations, people's expectations, some people will find a way forward and then start sharing that. And I think that will happen anyway. Wouldn't it be great if we could dedicate some of our efforts and some of our time to helping that be done kind of more safely and in a more sort of distributed way? That's probably a good way of helping fill that gap.
It's a good example, because I think, and you probably know that example as well, the artificial pancreas.
Yes, we are not waiting.
We are not waiting. Yeah, exactly. So where patients said, "Look, we need an artificial pancreas. We need to be in the know of how our glucose is, and we need to have insulin injected automatically, like your pancreas is doing if it's working properly." But there was not such a solution on the market. And so patients themselves hacked it. They basically hacked it all together with a Raspberry Pi and some existing tools. And they went onto community on GitHub to explain how they created the app. And so this is what we're seeing, right? This is where we don't want to wait, and patients take the everything in their own hands.
And within that, I had a brilliant story from one person. There was a product called Night Scout from the same movement. And what it was is that it would help put alerts on glucose monitoring overnight, because that wasn't available in commercial products. And I spoke to a parent of a child who'd recently been diagnosed with type 1 diabetes, the insulin-dependent diabetes. Now, think about this. You're a parent of a child who's been really seriously unwell and is now on a treatment that is returning them to health and wellness, but you have to give them a drug that you are warned might cause them to become hypoglycemic, and that's very dangerous, and, be very, very careful. And they deliver that medicine in doses, including 1 dose at night, right? Maybe. And you're told, well, if their blood sugar drops, they're going to have trouble. So imagine you're a parent giving a medicine to your child that has risks. How do you think you're going to sleep overnight with your child there, knowing that you have the ability to test the blood sugar and everything? Very disrupted sleep. Night Scout, with the ability to monitor this and alert if it's starting to look bad, helped break that. And the parent that I spoke to said, since using Night Scout back in the past, and there are other solutions now, they'd had their first full night's sleep since the diagnosis of their child.
That's amazing.
That is incredible, right? Are people building solutions based on letting a parent have sleep because they're not worried about their child? That's not going to sort of feature in a problem that a person's going to build a solution for. But it was that problem, amongst others, that drove the community to build Night Scout.
Yeah,
this is why empowering the people with the problems to help start to solve them solves the real problems, and not the problem that I as a doctor have in managing that patient.
Yeah, interesting. I got 2 more questions in my head, and I'll go back to healthcare and maybe to tech-enhanced care, if you will. When we talk in care, the first thing that comes to mind is human. And we always say healthcare is a human interaction, as a human business, even, if you will.
Yeah.
So with all these tech solutions, how strong do we need to stick to that statement? And at what part of healthcare needs to be human, or can it be, I don't know, emotions that are mimicked by human, or empathy that is mimicked by human? How much do we need to rely on the fact that healthcare is a human business in the future?
I think ultimately it won't matter.
It won't.
No, I think ultimately we all will establish relationships with non-human actors in whatever aspect of life that we have. I don't think we're there right now. We're getting some glimpses of it. So I think that will proceed. I still think that there's something very important about a human providing care to another human that's going to be potentially not replaceable by a non-human actor. But what I will also say is that humans are very, very good at forming relationships with non-humans anyway. We've all got pets and animals and
sure,
all that sort of stuff. AI may represent a new kind of category of interactive other thing, that we will start to develop our own comfort about what kind of relationship we have with it. And
And when?
so, yeah, and when and why, and
Mm,
what might be interesting is that
mm-hmm.
it get much more kind of like broken down. So for some things, I want to speak to a person. For other things, I would actually prefer to speak to a machine. And for some things, I'd rather just go for a walk with my dog.
Yeah.
We do that already. And I think I personally think that's what we're going to see emerging. So what I try and watch out for more broadly is how humans are interacting with technology now, how we change our language, our relationships, and everything. And within that, I think we're going to see emerging, the steps towards a very kind of mixed world of relationships.
Yeah. I fully agree with that. I think it will be discovery on where do we want what. And I
Mm,
think it will all come back to what you said earlier. What is the attention and time that we can get from it?
yeah.
Sometimes the attention might be better in some cases because it's faster. Because like in mental health, it's already proven in some vague, with very few patient studies, that people find it easier to talk to a bot
Mm,
than to an actual human being because there's less judgment, for example.
yeah.
So there are cases definitely where I also believe that this could be the case. And the statement is healthcare a human business. Probably not the entirety of healthcare will remain a human business, of course.
I will agree with you there.
Yeah. Now, final question maybe, and I know it's one of the questions that we already talked about in the past, is that if you would have to disrupt the entire system and you would ask patients or people in general, let's not even think about your typical patients with chronic diseases or severe diseases, but just people, if we would talk about how would you see the care part in the healthcare, how would you see it evolve, or how would you shape it yourself? What do you think they would look for? How would it look like if patients would be able to shape the care part of the healthcare?
So I'll cast myself as a patient here because I'd answer it maybe one way as a doctor, but that's the wrong way to answer it right now. Again, it comes down to time but whatever time that I get, because I think people appreciate that endless access to time is maybe nice, but difficult to achieve. What I would very much want is that the time that I have with the person that's providing care to me is the most human part of it. I would really want everything that the doctor caring for me or the nurse caring for me that is otherwise like in service of the technology or machine, like writing notes, coding things, bringing up
Yeah,
information. If that was dealt with, allowing them to be in the moment with me, speak with me, have that knowledge and information, and then be the human in the room, providing the role of the health carer, I think that is where we need to go. And I think what that inevitably ends up being is the conversation not being a two-way conversation with two things in the room, but a three-way conversation. Me, the patient, the other human in the room, and then the AI, the data, the machine part in there, a three-way conversation. And the human part is dealt with the humans, and then the rest of it is dealt with the machines. I think that is at its simplest where I think I would want it to go, but I want to get it to evolve to that place. I don't want it dropped on me. Let's see how we get there. But the more
yeah,
time I get with the human bits, the happier I will be.
I agree. I think if I would put myself in the shoe of a patient, or if I would look at what do I expect from the care parts in healthcare, or how do I see healthcare evolve, I think I would say two things. It needs to be faster. I want to have an
Mm,
answer faster, or a solution faster, or some information faster, and I want to have a better experience. I think
yeah.
it's both ways. And this is also what I always explain in my keynotes. I think right now the healthcare system is based on healthcare services, if you will. And those services rely heavily, as you said also previously, heavily on humans, which makes it not fast, and which makes it that because of the time pressure, the administration, what have you all, the experience is also not that good.
Mhm.
So I think we really should be thinking, if and I'm speaking from a patient now, I want it faster and have a better experience. But if we then put our, hat on of inspirators for the healthcare system, my advice would always be to look at what you have as healthcare services, try to turn as much as possible into products which are scalable, which can be, easier and faster accessed, if you will.
Hmm.
And then what part of those services need to become better experiences?
Yeah.
My statement is often get rid of all healthcare services because they're too slow. The experience is not that good. It's a provocative statement, obviously. But what I try to say is that turn them into products if it's feasible. Try to make them scalable and faster, accessible, and when necessary, turn them into better healthcare experiences, which then probably evolves largely empathy and humans and all of that.
Yeah.
So I think that would be the future of healthcare, or the care in healthcare, to me anyway.
I agree, and it's useful to think at the extremes and then work back, to break our fixation on how we do things now. There is one thing that I'm going to add, and we should maybe discuss this another time.
Cool.
Is that there is also a role in not responding quickly. This is definitely true. The problem that's in front of you right now and acting right now may be the wrong thing to do. And right now, it's a kind of bug and not a feature of healthcare that healthcare people know is like, it takes a long time to see a doctor, but that's good because actually some things will resolve anyway. We don't want to drive anxiety and so on. So that, but that we're not, the system isn't designed to solve that. It's just a happy accident that happens. How do we balance that very, very tight feedback loops, reacting immediately, sometimes is the wrong thing. And so I think exploring that at a later point would be interesting. But the general principle, I think, when you need to act fast, to be able to act fast, absolutely.
Yeah. And I agree with it. I think I once saw a keynote speaker saying that, and he was arguing with some studies that if you increase the quality and accessibility of healthcare, you'll never be able to meet the demand because the demand will even grow. If something is good, people will come even more, let's say.
Yeah. Free beer. Cool. Free beer is the good example.
Yeah, it's happy hour in the healthcare system.
Yeah.
That's kind of like a good referral there. Great. Time to wrap up the Healthusiasm podcast for this week. Thank you for listening. If you like this show, don't forget to hit the subscribe button on your favorite podcast platform. You can also visit healthusiasm.com to discover the other episodes, subscribe to the newsletter, and learn more about our panelists. Now I'd like to thank our panelists for their Healthusiasm. In this case, it is Dr. Keith Grimes. My name is Christophe Jauquet. We are the Healthusiasm Pedal, and we'd love to see you again next week for some more Healthusiasm.